Okay. All right. So this is what we're gonna take, and obviously, again, Daniel Williams, Piedmont Community College. This is the sterile dressing change, and obviously, I don't have a patient or anything like that. So we're just gonna improvise, and I'm just gonna mostly talk through it, and I want to try my best to try to emulate having a patient. This will be my patient in this sterile. This is the wound right here, which I got to do sterile dressing on, and this is going to sort of be my workspace. And if I say I have to, erase the patient and just make this my workspace, I'll say that just because I just don't have the workspace. I try to make sure I had enough view where I can prop up my camera and I don't have to worry about moving it, and I don't have to worry about editing anything. It just goes straight through. So, all right, so we're gonna go ahead and begin. All right, so I am going to approach my patient room, knock, knock, enter. I'm gonna enter the room, hand hygiene, enter the room, introduce myself to the patient. How you doing? I'm Dan. I'll be the nurse for this afternoon. And if you don't mind, I am going to have a doctor's order for me to change that sterile dressing. And if it's okay with you, I will go ahead and get that done this afternoon. Would that be okay? Okay, all right, cool beans. All right, so I'm going to check the patient's medical record, name, date of birth, check all that. Make sure the patient is good. Make sure that they're oriented. Make sure they're pretty much okay with what I'm doing, and I won't have any issues with that. Before I do that, I'm just going to make sure my area is safe. Make sure everything in the room looks like it's working. I don't see any hazards, anything like that. No electrical wires. Oxygen is working, and everything is good. So we're going to go ahead and continue with that dressing. Now, I will ask the patient if I was aware that the patient did have any issues with pain or anything like that. I would have had addressed that before I came in the room. 30 minutes before I did the dressing, I would have made sure that I addressed the patient's pain, so when I came in, that the patient was comfortable enough, so that I can go ahead and do the dressing. Now, of course, before I would have did that, I would have asked if the patient had any allergies, anything like that. Of course, I would have checked the medical record and make sure that I didn't have any issues with giving him pain. We didn't have any conflicts with that. So now, going forward now, I would ask the patient, hey, Mr. Patient, do you have any pain? From 0 to 1 to 10, do you have any pain? He says no, he don't have any pain. Again, if he did have any pain unrelated to the dressing, I would have addressed his pain issue. If he did have it, again, I would ask him if he had any allergies, anything like that, or ask him if it's okay for him to swallow. And then I would go ahead and address his pain. And then I would step out and give him some time to swallow, make sure the pain sets in, and then I would go ahead and continue again. Okay. We'll come back in the room, hand hygiene, verify the patient name, date of birth, MRN number, and make sure that we're good. All right, so now we're gonna continue with your dressing change. I'm just gonna raise the bed up just to my height, just because, a little tall, so that way I'm not bending down. I will raise the bed up, make sure everything is secure. After that, all right, so I'm going to put some hand hygiene on. I got some fake hand hygiene, okay? And I'm just going to put some gloves on, just some regular clean gloves. Nothing crazy. These are still too small for me, but we're just going to put them on for right now. So this is patient's drain. The person drained patient's wound. And now I'm gonna go ahead and uncover the patient. I'll make sure the patient has some privacy, patient privacy. Make sure the privacy is good, and make sure I don't uncover anything that doesn't need to be uncovered. Okay, just to expose the wound. Okay, So, all right, so now um, now we're just gonna take the dressing off of the wound. Now, I mean, I know inside the kit there is a trash bag inside the kit. Since I have not opened the kit yet, I would just either place a chuck or a continence pad right here, right next to me, so that I can throw my dirty stuff onto that continence pad and get rid of it. People do different things. All right, so I'm going to attempt to take the dressing off. If the dressing was stuck on here really, really good, I said I would use some saline to kind of loosen it up, or some alcohol just to kind of go around the dressing just to loosen it up so I can get it off. So, all right, so now we're going to attempt to take it off. I'm taking off the tape. Okay, taking off the tape, and this is the ABD. Taking the ABD pad. I'm inspecting the ABD pad just to kind of see the type of drainage on the ABD pad. All right, so pretty standard. Doesn't look like there's anything abnormal with the drainage. So now I'm going to go ahead and take the gauze out from the patient. I'm not touching the wound. I'm just taking the gauze out, and the same thing with the gauze. The gauze was stuck and hard to get out. I also would put some saline in there just to kind of loosen it up, just so I can get the gauze out. I'm taking the gauze out. I'm inspecting the gauze, looking at the drainage on the gauze. Maybe even smelling the drainage on the gauze, taking the gauze out, feeling the heaviness of the gauze, just trying to see if there was, light, medium, heavy type drainage on the gauze. And everything seems pretty standard. Smell doesn't seem abnormal, anything like that. So I'm gonna go ahead and take my ABD and toss it in the trash. Okay. And now I'm just inspecting the wound. I'm not going to do anything harsh, meaning like I'm not going to touch on the wound, on the edges of the wound too hard, but I'm just going to feel just the edges of the wound, not inside the wound, just making sure that there's no soft spots or anything like that. So basically you just want to kind of feel just around it, nice and gently, just kind of get a feel, just make sure there's no tunneling that you can kind of notice from the outside of it. And then you can go ahead and look into the drain and see, into the drain, Lord have mercy, into the wound. You can look into the wound and just see how it looks, looking at the size of it, obviously looking at the color of the wound. And everything like that. So, okay, got everything off. If I noticed anything irregular, I would note that, and I would make sure I would chart that later on. So, right now, wound is clear, it's out. So now I'm going to go ahead and set up my sterile. I'm going to set up my sterile field, and I'm going to open up my dressing package. Now, because everything is inside my dressing package, I'm just going to talk this through, because this is going to be my space that I use, and also this is going to be my patient at the same time. But I'll tell you when I erase the patient, okay? Just because I don't have that much space. All right, so now, gloves off, okay, hand hygiene, clean. All right, so now I'm getting my sterile kit, and this will be now my table or whatever it is, and I'll make sure my table or my spot that I'm using is at least clean enough for me to just place down my stuff on it. So, all right, so let's see. Okay, so now I'm going to set up my sterile kit. I'm going to open up my sterile kit away from me, okay? Away from me. All right. And then now we got it open. And then now, since I have my kit open, I'm just gonna move my kit to my other clean spot, right? To my other clean spot, not on my wheel, just to my other clean spot. Drop it down. All right, so now I'm going to at least take out my sterile gloves right on the edge there. Now I'm going to don my sterile gloves, right? Okay. Don my sterile gloves. Hopefully this is being caught on camera. Okay. Top the middle. All right, good deal. All right, so dominant hand is first. And we're gonna put on our sterile gloves just by touching the edge of the sterile glove, just the edge, okay? Just the edge of the sterile glove, okay? Just the edge of the sterile glove, and that ripped. So technically, it would be the edge of the sterile glove, right? So I got big hands, and my gloves are not. My gloves don't actually fit. I tried to even use a big glove, but it still didn't work. Okay. All right. So touching the edge of the sterile gloves. All right, just the edge of the sterile gloves. All right. Dominant hand on. All right. So now, non-dominant hand. Okay. All right. So on, and then now if I did have an issue, I can touch my two sterile gloves together just because they are sterile, so I can correct anything if I did have an issue putting them on. Okay, sterile gloves on. Now, and now I am going to keep my hands up, don't drop them don't drop them below my waist. All right, so then now I'm going to take my kit and I'm going to go ahead and set up my sterile field right here. So technically, if this was here and I needed to move it, I can just move that out of my way. And then now I'm going to go ahead and set up my sterile field. So now I'm touching my sterile cloth from the edge, technically from the edge. I was technically supposed to be from the edge, but the way I put it in there didn't. Make sure I don't touch the table. Okay. Of course, the shiny part of the sterile cloth is going to go down. Okay. And the edges, of course, it's technically not sterile. And then after that, I'm going to take my kit and either can place it right in the middle of it, or I can dump it in. People do it different ways. I'm just going to place my kit right in the middle of it, and everything I have is inside. And now, again, just for recording purposes, I'm going to reestablish my patient, right? So we take a pause, I'll reestablish my patient. And I need my dressing. Okay, all right, so recording in. I have my dressing right here. I have my contents right here, and I have everything in it. Sometimes the saline is outside of the package. I just put mine inside the package because I don't have anybody to hand it to me. And I'm gonna take all my stuff outside of it. And here is my trash bag, which I can set up my trash bag and place it right here and open it up so I can throw my trash in it. As long as I don't touch anything, I set my trash bag up right next to me. If I did have something, my trash bag would be clearly right in the view of me, wouldn't be below me. So anyway, now I'm gonna take everything out. I'm gonna speed that up. just because time is of the essence. Okay, I will speed that up, take all my stuff out of it. Alright, so I'm running out of time. Gauze. I already filled my gauze, so I'm taking gauze out. Okay. And my gauze technically could stay inside that little compartment. I will open up my saline. Alright, I will open up my saline. And what some schools do is, because you open up your saline, you are to just kind of pour a little bit of your saline out into the trash, just to kind of clean the part of the bottle that you're going to pour and use for your cleaning and your packing. So, I mean, technically I can do that. I will pour my saline into my tray, and after I pour my saline into my tray, I will dispose of that trash, drop it into the trash. Okay, so now I'm going to take out my Q-tip here, and then now I'm going to get to measuring my wound. Okay, I'm going to measure my wound. I'm going to take it, I'm going to check the depth of the wound, go down to the depth of the wound, put my Q-tip down as far as it goes, pull it up without me touching the inside of the wound. I will measure that with my ruler. Say I got 4 centimeters, and then now I will go ahead and measure the then I'm gonna go ahead and measure and if I have multiple Q-tips, I could just toss that Q-tip aside. I don't need to use it again. But then I would measure the length of it. I would measure that 10 centimeters. I would measure the width 6 centimeters. I will measure that so I can chart that later on. After that, I will go ahead and dispose of that Q-tip. Okay, now I'm gonna go ahead, again, just while I'm doing it, keeping my eyes open, just inspecting my wound. Like I said, I tossed that away. I don't want to throw it in the trash right now. And then now I'm gonna go ahead and clean my wound. Now I have my gauze. Okay, make sure I got my gauze is wet. I'm gonna go ahead and drain my gauze out. Make sure I don't drip anything on my sterile fill, because if I do drip anything on my sterile fill, then I will have to go ahead and start again, just because my sterile fill will be compromised. Okay. So now from the center of the wound, in a circular motion out, I will clean it out. I will dispose of that gauze. I will get me another gauze. Same thing. I will continue to clean that wound until I'm satisfied that it's clean, until there's no more debris on my gauze. And once I finish with that, I'm done with that gauze, done. All right, so now we're gonna clean the outside of the wound. Same thing, another gauze. And what we can do is have 2 sides of that gauze. We're gonna clean the outside. We're gonna go from top to the bottom of the wound on one side, top to the bottom of the wound on the other side, flipping the gauze, making sure we use the clean sides of the gauze. Once we finish with that, we are gonna toss that gauze. And then now we're gonna get another gauze, and now we're just gonna make sure the edges are dry. Okay, we wanna make sure the edges are dry. Once it's dry, then now we're gonna go ahead and pack. All right, we're gonna pack the wound. So now again, now we're gonna take up our packing dressing. We're gonna see how much dressing we need. Okay, and say we need this amount. And actually, what I'm gonna do, I am gonna cut that, just because I just feel like being in the moment. So we're gonna go ahead and cut that. Okay. All right, same thing there. We're gonna wet that gauze. Like again, we don't want it soaked. All right, we don't want it soaked. We do want it. Basically, we want it wet, just a little bit more than damp, because we want it to get into that wound and absorb some of that debris in there. So what we're going to do is we're going to get our dressing all right, fit enough so that we can put it into our wound. And again, we're gonna start again on the middle, and we're gonna circle it around all the way to the wound is packed. We're gonna put it in there, and then again, if we need to do some more, we'll see if we need some more. Say we do, we'll do it again, cut another piece. Same thing, dry it out, make sure it's not dripping, make sure we don't drip anything on our sterile film, and we will go ahead and put that in there as well. Now, again, if there was any tunnelling or anything like that, we will also pack that. All right. So now, when I was measuring my wound, I would check to see if there was any tunneling. Now, when I did touch, I didn't find any tunneling. When I looked, there was no tunneling, so I have no tunneling to pack. Now, if there was tunneling to pack, if there was tunneling, I would have measured that, and I would pack that if there was any tunneling. So there's no tunneling, so I have just dressed my wound and make sure that I put my dressing inside, and make sure I didn't touch the outside of the wound, because then I will become unsterile, and then I would have to reapply my gloves if I did compromise my gloves, which I didn't. So wound is packed, and then after that, I would take some sterile ABDs, put it on top, sterile gauze, I'll put it on top, and then I would go ahead and take my ABD, okay, and put that on top, okay, and then I would take my tape the sides, 1, 2, 3, 4, I would take another piece of tape, write my date, time, initials on there, and put it on there. And technically, after that, I will be done. Okay, clean up my mask, clean everything up, cover my patient, make sure my patient is covered. Lower the bed, make sure the patient is safe, bed alarm on, give the patient a call bell, make sure the patient has a call bell, make sure the patient is safe. After that, if they have to dispose everything, take all my gloves off. So like I said, again, clean up my mask, hand hygiene, make sure the patient is good again, and then I would obviously probably before I even left the room, I would chart everything, again, smell everything that I did. I would chart everything. I would chart the size, I would chart the date, time, reaction of the patient, the response of the patient. I would chart everything I did. Make sure that it's completed and charted. Done.